everyone. I'm Dr. Tife Debbie. I'm a consultant psychiatrist and a psychologist. I create videos on mental health education and self-improvement tips. My goal is to help demystify mental illness and provide you with tools that will help you be your best and live your best. On today's video, I will be talking about symptoms, phases, and diagnosis of schizophrenia. The symptoms of schizophrenia are largely divided into three categories: positive symptoms, negative symptoms, and cognitive symptoms. The positive symptoms include symptoms like delusions, hallucinations, disorganized behavior, disorganized speech, and catatonic behavior. Now, for delusions basically are fixed false beliefs, which means that the individual would hold on to a belief and will say, and this belief does not shift to evidences that prove otherwise. So for example, the person may have a paranoid delusion. That means the person may suspect or feel as if their life is under some form of threat or the other, feeling as if people are against them or want to harm them. Or the person could have a delusion of reference, which means that the person believes that certain conversations or certain things being done around them, maybe on TV, on the radio, has a particular reference to themselves. When it comes to hallucinations, just simply means the person having an experience of a perception that is not actually happening. And when I talk about the perception that's not actually happening, I'm talking about the perception in any of the five senses. The commonly experienced hallucinations are auditory hallucinations. That is, they hear voices, or sometimes also they could experience visual hallucinations. But hallucinations could occur in any of the five modalities. In other words, the person can also smell things that are not there. The person can feel things that are not there. That makes for the hallucinatory experiences that someone with schizophrenia may have. Then we'll talk about the disorganized speech. In disorganized speech, you may have the person just making conversations that really do not make sense. So you could experience something called a word salad, where the person just makes words that literally does not make sense. Sometimes the words may make sense, but you may find the person really going around the conversation before they finally come to a point where you can understand them. Many times what you experience here, especially with loved ones, you have to pay attention a bit longer because the person takes a while to get to the point that they are trying to get to. And with disorganized speech, you could also have them creating words that do not actually exist, or using words that exist to refer to things that do not make sense. So for example, someone may say traffic and he may be referring to just the pen, and they may be calling the pen traffic. That's creating words, using existing words for something that is inappropriate, or just creating words that do not even exist at all. It could be disorganized behavior. In disorganized behavior, you could have the person with outbursts of anger, outbursts of irritability. It could be that the person begins to wander aimlessly for no apparent reason, and just a lot. The behavior is just a bit bizarre. It could be awkward mannerisms, and then finally it could be catatonia. With catatonia, you could have the person resisting a movement or staying in a particular position for a long time. So that makes up what is referred to as the positive symptoms. Positive symptoms do not necessarily mean they are good. They basically, as you may have noticed, just refer to the psychotic symptoms. That is the symptoms that allows the person or makes the person lose touch with reality. Then you have the negative symptoms. For the negative symptoms, it really is focused on the expression of emotion. So you could have someone having something called a flattening of affect. A flattening of affect is where there is little or no emotional expression. So you're having a conversation, something that should be funny or something that should make the person cry, and you literally don't have an emotional response. A negative symptom could also be a lack of words, something called illogia. So you will have the individual just be very, very brief with their words. Maybe you're having a conversation with them and you ask a question, how was your day? How you doing? And you expect like a lengthy response, but the person just gives you a very brief response. Good, fine, and just very brief like that. It could also show in something called avolition, which is a lack of motivation, or just getting things done is a lot of work for the individual. That refers to the negative symptoms. Then finally, you have the third category, which is the cognitive symptoms of schizophrenia. In the cognitive symptoms of schizophrenia, basically what you experience, it could have to do with memory, it could have to do with learning, it could have to do with understanding. Those are the three categories that the symptoms of schizophrenia is divided into: cognitive symptoms, negative symptoms, and positive symptoms. There are three phases of schizophrenia, or three stages as you may want to refer to them. The first stage is called the Prodromal Phase. The Prodromal Phase simply is that phase where the individual may present with symptoms like nervousness, symptoms that suggest depression. They are usually kind of vague symptoms, because these symptoms that you see in the Prodromal Phase can as well occur in any other some other mental health conditions. Then you have the active phase of schizophrenia. Now, or the active, it's also called the acute phase of schizophrenia. In the acute phase, this is where you have the symptoms that are earlier listed. That's the positive symptoms, negative symptoms could occur, and cognitive symptoms could occur in this active phase. And then the last but not the least is the residual phase. In the residual phase, there is a significant reduction in the symptoms that are seen in the active phase. Sometimes like a return to the prodromal phase. I must say that it's important to note that not everyone that experiences schizophrenia will go through all these three phases. Some persons may not experience the prodromal phase, and they may just go from being normal to experiencing the acute or the active phase of the illness. But it's very important to remember that some people experience the prodromal phase. And this is important because sometimes people will present with what looks like depression and later be diagnosed as having schizophrenia. Making a diagnosis of schizophrenia therefore requires there to be, we're going to list 5 symptoms. Now, of these 5 symptoms, there has to be at least 2 of these symptoms to make a diagnosis. So the first is delusions, the second, hallucinations, third, disorganized speech or grossly disorganized speech. Number 4 is disorganized behavior, and then number 5, negative symptoms. Now, there must be at least 2 of these symptoms to make a diagnosis of schizophrenia. But it is important to note that of these 5, 1 must be at least from the top 3. That is delusions, hallucinations, and disorganized speech. Now, that's the first criteria. So 2 symptoms. The second criteria is that these symptoms should have lasted at least 6 months. Now, that's when we're looking at the phases, the prodromal phase, the residual phase, and the active phase. But once you have active symptoms or acute symptoms lasting at least 1 month, even if it's not up to 6 months. Remember, I'd mentioned that you don't have to have, sometimes some people don't go through the prodromal phase. So if you have acute symptoms lasting at least 1 month, then it is diagnostic. And then the third criteria is the fact that none of these symptoms should be attributable to something else. For example, it should not be attributed to drugs, because certain drugs can cause people to hallucinate, and certain drugs can cause people to be paranoid. So it shouldn't be that it's drug induced that's producing the symptoms. It should also be due to a medical condition that is causing that the symptoms that are presented. So there you have it. I hope this video has been helpful. Just in case it has, kindly spread the word. Let's spread the awareness. If you have not subscribed, please do. so that you don't miss out on any of the subsequent videos. Thank you very much.